FH is an autosomal dominant disease. It's a genetically inherited disease, unlike some other hyperlipidemias, which means it can be carried from one generation to the next. There are different ways of diagnosing FH, a lot clinically through family history, biochemical tests looking at lipid levels, LDL cholesterol for example. But definitively, to get a diagnosis on FH, as it is an inherited genetic disease, genetic test, as the NICE guidelines, National Institute of Clinical Excellence, they recommend use of a genetic test to definitively diagnose FH. The problem with FH has been that patients with the condition are often not diagnosed till later on in life, which means that they have accumulated quite a lot of fatty debris in their blood vessels, which makes them more exposed or more conditioned to a cardiovascular event or problem. So early diagnosis is key. The health benefits are if you diagnose by mutational analysis sooner rather than later, then you can start maybe perhaps a more aggressive treatment using a higher dose of statins, which you basically use to lower the cholesterol level than what you would normally, a normal statin dose. For FH patients, they require a higher dose of that to have the same effect as someone without FH, but just have elevated LDL. So yeah, there's definite health benefits in doing screening. On the cost side, I mentioned before about comprehensive analysis. They are that. They have the possibility of detecting more genes, but it does take a lot of time and does take a lot more money. So you're talking several hundreds of pounds to diagnose by comprehensive genetic analysis, as opposed to, a quick, rapid test, right, such as Randox have developed that look at the key mutations. And cascade testing is the ideal, where essentially you identify a mutation in an index case who comes into a clinic or comes through the hands of a chemical pathologist, and they give an FH diagnosis. What you want to do then, in an ideal world, is collect samples from family members and test also for the mutation in those. Funding for that in the UK, some regions have this, have support and funding, and others don't. But having an FH nurse, essentially someone who can either go direct to the family members or coordinate in some way collection of samples from members of the proband family to collect the samples. That's the ideal scenario, where you're basically doing more testing. You wouldn't necessarily pick up that there's something going on until quite often it's too late, and that generally is the case with FH, unless you're doing systematic cascade screening. We've been doing this for a while in Northern Ireland, and it's been working very well. And this, as I say, on average, we're doing cascade testing in about 8 family members from a single index or proband case. But yeah, otherwise it could be a condition that remains undiagnosed for many years until all of a sudden, often out of the blue, you can have a cardiac event, which leaves you in a hospital, emergency department, where they start, at that point, maybe start just looking at some of the lipid tests and other things at that stage. So yeah, cascade testing is absolutely key.